Hi, my name is Kate Ackerman, and I'm going to talk to you about the acute aspects of the female endurance athlete. So my only disclosures are that this is a presentation sponsored by the Gatorade Sports Science Institute, and the views expressed are those of myself and do not reflect any position or policy of PepsiCo. I also separately do talks for Hologic. So the objectives of today's talk are really to discuss the basis for female athlete sports nutrition recommendations to date, describe important considerations for accurate female sports and nutrition research, describe causes and consequences of low energy availability, so talking about female athlete triad and relative energy deficiency in sport, and to provide some basic female athlete nutrition advice. We'll also touch upon future directions. So it's very important to realize that the majority of sports science research was and is still being performed in men. Really, there's a paucity of females being studied. Of 1,382 exercise medicine studies published from 2011 to 2013 in the British Journal of Sports Medicine, Medical and Science and Sports and Exercise, and the American Journal of Sports Medicine, women made up about 39% of total subjects. And then in a follow-up study in the first 5 months of the next year in 2015, or a couple of years later, you can see that there was still this inequity. So studies by gender, where they looked at just men, 27%, just women, only 4%. And then both genders, but not always specifically a 50-50 split, 69%. So even in those studies where there are women and men, only 42% are including women. And then when we break this down and really look at disease studies, basic physiology, metabolism, diet, and obesity, injury, social, and performance issues, we still see these discrepancies, some of which are much bigger. So injury, for example, there are only 2% of studies that just focus on injuries in women. When we talk about metabolism, diet, and obesity, the studies that were published in 2015 had no mention of women. And in performance, again, it's a very small proportion. So when we make these different recommendations about sports nutrition and fueling for the female athlete, we're often basing this off of studies that were done in men. So why aren't women studied more? Well, we can be very hard to study. We have to think about the general training status and fitness in people in general. Usually you have to take into account pre-intervention dietary status. You want to consider the type of exercise studied. So is it a time trial versus exercise to exhaustion? You need to consider the duration and intensity of exercise just prior to the intervention. And then when you're thinking about women, you have to consider the phase of the menstrual cycle. If the athlete has menstrual dysfunction from low energy availability, are they perimenopausal? Are they menopausal? Are they pregnant? Are they on birth control? What kind of birth control are they on? Do they have underlying conditions such as polycystic ovary syndrome? So there are a lot of considerations to control. This can be extremely time consuming and expensive when you're tracking these women. And so a number that really sticks out in my mind is when looking up different urinary hormones to study. If you were studying 4 urinary hormones daily for 4 months and 120 women, guess how much that would cost? $1 million. So yes, we are expensive. And then when we think about the menstrual cycle and we want to take that into consideration, you have to actually have some knowledge about the cycle. So typically the first day of the menstrual bleed is day 0, and this is the very beginning of the follicular phase. And this is when estrogen is rising. Then you have the LH surge, you have ovulation, and then you have the luteal phase. And here you'll see this increase in progesterone. But let's say you have somebody who's on the pill. They're going to have these increases in estrogen daily because they're taking a pill with estrogen and progesterone daily. So they have this increase in estrogen and progesterone daily. Their FSH and LH are suppressed. And then those levels are going to be dropped during the placebo phase. And then you might have somebody who's perimenopausal and their hormones are kind of going all over. And it's very hard to predict when the estrogen and the progesterone are rising. You'll see these changes in these levels. And then when they hit menopause, FSH rises and LH rises and estrogen and progesterone are low. So what type of woman are you studying? And are you taking these things into consideration when you're talking about nutrition? And then let's say you have somebody who is eumenorrheic. So they're considered to have normal menstrual cycles. If you look at the top on the right here, you'll see that this person has about a 28-day cycle. That's what we consider normal. But normal is actually 28 days plus or minus 7. So if you are studying female athletes who are eumenorrheic, All three of these bars, these graphs on the right, are representing somebody who's eumenoric. That top person is a 28-day cycle, the middle one is a 24-day cycle, and the bottom one is a 35-day cycle. And notice how those hormone levels then would not match up. They're ovulating at different times, so they're hitting peak estrogen and progesterone at different times. So it's sometimes good to actually measure the hormone levels as you're studying a person, because we have these different phases. You have early follicular, late follicular, ovulation, early luteal, mid luteal, and late luteal. And it's important that we all get on the same page when we're talking about this. And we recently published a paper that was discussing how we can kind of really formulate a plan so that people are all doing these studies in a pretty uniform way so that we can make some really good contributions to what is happening with nutrition in women. Here's where ovulation would be in a patient. But again, it really depends on where these levels are. So you want to measure this. And you can do this by measuring urinary hormones, ovulation kits, doing some blood labs. But there is a system to it that we need to be following. The other thing to keep in mind is we may make nutrition recommendations, but we have to keep in mind that someone needs to get enough calories in for this to even make a difference. So for example, the female athlete triad, which is a term that was coined in the early 90s, was based on the concept that when you have low energy availability, you'll have menstrual dysfunction and you'll have low bone density. We now think of this along a continuum. So why do I bring this up in a nutrition talk? Well, this is extremely prevalent. So up to 78% of high school varsity female athletes were found to have one or more component of the triad. So when we're talking about nutritional interventions or how to get the optimum performance out of somebody, if they're not getting enough calories in, some of these macronutrients or some of these supplements that we're suggesting may not make a difference if the underlying nutritional basis isn't being addressed. So energy availability and menstrual function have this link. We know from studies that were done years ago by Ann Laux and others that when you drop below a certain energy availability, you will have these changes in various hormones. And so years ago, Ann Laux found that when an energy availability dropped below 30 in recreational adult women, that there was a change in LH pulse amplitude and frequency. And over time, we found that this may not be the perfect number for everybody, but people do have energy availability set points. And so somebody who's younger and going through adolescence may have a much higher energy need. They might need to be closer to 45. Somebody else might be able to get away with a little bit lower. So it is individual and it may change at certain times during somebody's lifespan, but it's important that every individual is hitting an energy availability where their hormones are at their best. So for example, we know that there's this dose-response relationship between energy availability and LH pulsatility. And just to explain what energy availability is, it's the dietary energy intake minus the exercise energy expenditure, and then it's normalized to fat-free mass, so lean mass. So you could take, for example, a young runner who says that she eats 2,000 calories a day. She might go for a run and burn 600 calories. Her fat-free mass may be 51 kilograms. And so if you do that equation, her energy availability would be 27.5 kilocalories per kg of fat-free mass per day. But again, this is much lower than 30, and this isn't an atypical caloric intake for some of our teenage athletes. So one of the things that I spend a lot of my day doing is telling our young athletes they need to be eating more, and they're often surprised at their energy needs. Again, 30 may not be the number for anyone, for everybody. A lot of people really need to be 45. 45 may be the ideal. So keep in mind the personal variation. It's also important to realize it's not just about estrogen. It's not just this linkage between energy availability and estrogen, which certainly is important, but there are so many different things that contribute to low bone density. And all of these things on this slide are off kilter when there's low energy availability. So you will find a decrease in BMI, in fat mass, and lean mass with low energy availability. You'll find a decrease in FSH, LH, estradiol, and androgens, a decrease in insulin, glucose, IGF-1, T3, a form of thyroid hormone, and leptin. And then in some of these GI hormones, there'll be an increase in fasting PYY, ghrelin, the stress hormone cortisol, and there will be increased growth hormone resistance. Everything in green on this slide is actually has a positive influence on bone, and everything red has a negative influence on bone. And you can see that these arrows are all going in the wrong direction when there's low energy availability. So in 2018 or 2014, the International Olympic Committee came up with a statement called Beyond the Female Athlete Triad, Relative Energy Deficiency in Sport. And this was really talking about the fact that energy availability is important. We know that the triad exists, but there may be other health and performance consequences that are also important. And so they came up with these spoke and wheel diagrams to talk about the other aspects in addition to triad that are affected with low energy availability. And then in 2018, there was an update to that paper and basically discussed other findings that have been discovered since the 2014 time. And now the IOC is working on yet another update and doing more research to really hone in and determine some of the pathways that cause these effects on the different bodily systems with low energy availability. So these are the two diagrams. And on the left, you can see these are the potential health consequences. And on the right, you can see that these are the potential performance consequences. So on the left, again, you see there's the triad, and that involves the relative energy deficiency, the menstrual dysfunction, and the poor bone health, where someone has increased risk for low bone density, increased risk for stress fractures and stress reactions. But then if you go around the circle, you can see that the endocrine system is affected in other ways as well. So the thyroid becomes dysfunctional. You can test T3 and find that T3 is low. If you go to the next circle, the metabolic system, athletes often will have suppressed resting metabolic rate when they have low energy availability. Looking at the hematologic system, we will see abnormalities maybe in the white blood cells. We might see iron deficiency or low ferritin. Growth and development, we have definitely seen athletes who, when they are energy restricted, fall off of their growth curve. So they're not gaining the weight as they should, and they may not be gaining height as they should. Psychological effects are extremely prevalent. And this arrow goes in both directions because people who have low energy availability can sometimes have psychological sequelae, and people who have psychological issues may be restricting their diet. So it goes in both ways. Cardiovascular system, we know that there are effects sometimes on lipids. We also know that there can be endothelial dysfunction. So with a decrease in estrogen that comes with a decrease in energy availability, it has an effect on nitric oxide, which has an effect on vascular vasodilation. GI system, when we look at athletes and we look at patients who have anorexia nervosa, there are many GI symptoms that come with that. Often people will feel bloating, they may have constipation, and later they might have IBS. And finally, immunologic system. So it seems when some people are extremely overtrained and or they are low energy availability, they can have some white blood cell suppression, they have an increased incidence of illness. Then when we go to the other circle, there are a bunch of things there that we've seen more clinically, and this is a spoke and wheel diagram that we need to do more with, but we definitely see increased injury risk. We can see decreased training response. Some of these athletes will have impaired judgment, decreased coordination, decreased concentration. They may be more irritable. They may suffer from depression. Often they will have decreased glycogen stores, decreased muscle strength, and we do see decreased endurance performance. So here's a study that was done in junior elite female swimmers. They were ages 15 to 17 years, and they were divided into a group that was cyclic, meaning they got their period every month, or ovarian suppressed. And this was based on their estradiol and progesterone levels. So basically people either got their period or they didn't, but they monitored them by looking at their estrogen and progesterone levels. They were monitored every 2 weeks over a 12-week period. And the ovarian suppressed, as expected, had suppressed estrogen and progesterone throughout the season, and they had a decrease in T3. As I mentioned earlier, T3 can be a marker of low energy availability, and they had a decrease in IGF-1 at week 12, while the cyclical swimmers did not have that. Energy intake was measured, and energy availability was lower in the ovarian suppressed. And I love sharing this study with my athletes because the ovarian suppressed had a 9.8% increase in their 400-meter swim time, while the cyclic had an 8.2% decrease. So if you just take a step back, here are these swimmers that are training the same, and they've had 12 weeks to train, and the ones who are ovarian suppressed got slower, while those who had these cycles every month got faster. We did a survey of our female patients who came into sports clinic. These were patients who were ages 15 to 30. We defined athlete as equal to or greater than 4 hours a week of exercise and on a sports team. They came into sports clinic for all different issues, concussion, ACL, all sorts of things. We actually found there's a 1.5 time greater odds of decreased endurance performance with those with low energy availability versus adequate energy availability. We also found a really high percent, almost 50% of our athletes answered positively to low energy availability questionnaires. So when I think of nutrition for the female athlete, I really start thinking about it like a pyramid. And these don't have to go into perfect order, but really at the base of the pyramid needs to be appropriate energy availability and appropriate hydration. Next, we think about the macro and the micronutrients. Then you want to think about the timing of your food. So pre-exercise, intra-exercise, post-exercise fueling. To do that, you want to think about the exercise intensity and the duration of the exercise. What's the type of exercise? Does the athlete have their own endogenous hormones at play? Are they premenopausal, postmenopausal? Are they on any exogenous hormones? Are there any other age effects we should be considering? And then we need to think about the individualization. So are there certain allergies? Are there certain foods that aren't compatible or palatable to them? So all sorts of things that really get to the nitty gritty of what a personal preference or personal need might be. So when we think about nutritional advice, again, we want to consider in general the duration, the intensity, and the frequency of the exercise. Often, a lot of the conclusions we make are standardized to body mass. But we have to remember women are typically not only smaller than men, they also have a lower lean body mass per fat mass ratio. Sex hormones affect metabolism and weight. Therefore, studying women and then guiding athletes requires studying amenorrheic, eumenorrheic, oligomenorrheic athletes, OCP users, masters athletes, and pregnant athletes. We want to study the different phases of the menstrual cycle in the eumenorrheic athletes. We want to study different types of OCPs. So there are oral contraceptive pills with different doses of estrogen, and there are also different OCPs with different types of progesterone. And then when you apply these results to individual women, you certainly need to be taking these findings and incorporating them and applying them with taking into their own needs. So what are the general female endurance athlete guidelines? In general, energy intake should probably be greater than 45 kilocalories per kg of fat-free mass, plus the energy spent during physical activity. So again, thinking about that 30 kilocalories, you probably need to be doing much higher than that. In terms of protein, it's generally recommended 1.2 to 1.4 grams per kg of protein for a female athlete, but more recent research suggests 1.6 grams per kg per day. And in female endurance athletes who are doing moderate intensity exercise for 1.5 hours a day or more in the mid-follicular phase, this can be specifically important. In terms of carbohydrate, the general recommendation is greater than 8 grams per kg, and it's efficient if the total energetic balance is adequate. In terms of iron, in general, 18 milligrams is what's recommended, but it could be somewhat lower for someone who's on an oral contraceptive. Also, we really have to consider, is this somebody who has light periods? Do they have heavy menstrual bleeding? What's the type and amount that they're training? If they're doing endurance, they're going to be churning through their red blood cells more, so they might have more iron loss because they're breaking down red blood cells. If they're doing endurance and they're a runner, so they have foot strike hemolysis, that might affect their iron loss as well. And then what's the general training environment? Is it at altitude? So we need to be also, again, personalizing this. Calcium, in general, 1,000 milligrams for an adult woman, but for an adolescent woman, it's 1,300 milligrams. It's also important to remember that we only absorb 500 milligrams at a time. And some suggest that amenorrheic athletes may require even additional. And again, this is personalized because someone might not lose their period at all. If they're truly amenorrheic, are they really needing more calcium for their bones? So again, we have to be looking at the individual athlete. The vitamin D level in general should be over 30 to get the appropriate response with PTH. But vitamin D, the general recommendations are 300 to 2,000 international units. I like to go off of the levels. So I like to get a level on somebody, make sure that they're over 30, and usually about 1,000 international units a day will keep them in that range. And then here they put 75 to 80 nanomoles per liter, but if you use other milligrams per deciliter, it's going to be 30. And then for water, in general, 2 liters plus the water loss during physical activity. So is this somebody who's a heavy sweater? Is this somebody who really churns through liquid? Water can be beneficial. We can talk about various drinks depending on the environment and how long they're exercising. So why do we care about the effects on women, and how is estrogen at play here? Well, estrogen is actually an anabolic hormone. It has a protein-sparing effect. So during endurance exercise, at approximately 65% of maximal oxygen consumption, women oxidize more lipids, and therefore they have decreased carbohydrate and protein oxidation compared with men. Estrogen actually impairs gluconeogenesis. So in the luteal phase, there's less reliance on muscle glycogen during submaximal exercise in the fasted state compared to the follicular phase and to male athletes. And exogenous carbs can help overcome impaired gluconeogenesis. So this may be important during certain times of the cycle. So how does somebody carb load? How do you carb load for the female endurance athlete? Well, in the mid-follicular phase, carb loading of 8.4 to 9 grams per kg of body weight per day increased muscle glycogen concentrations about 17 to 31%. But there really weren't any improvements that were noted in time trials. In the mid-luteal phase, muscle glycogen concentration was unchanged or only slightly increased, about 13%. Improvements in the time trials were not seen, but improvements in cycling time to exhaustion at 80% VO2 max were shown. So again, how are we measuring the performance? Men demonstrate an increase in muscle glycogen concentration of 18 to 47% when they carb load. How about with an OCP? So let's say you have a triphasic ethinyl estradiol and levonorgestrel pill. That means this is a pill that is ethinyl estradiol, and then there are these different doses of estrogen at the different phases in the cycle. So increased muscle glycogen, OCP, actually I take that back. There's a triphasic, they have the same dose of ethinyl estradiol, but they have changes in their levonorgestrel. So they have increased muscle glycogen concentration in the mid-follicular and the mid-luteal phase with carb loading, but this may be because the estrogen levels were similar in both phases. What about carb loading that's just in general? How would you recommend it to somebody? So often we say carb loading should be 8 grams per kilogram of body weight per day. This can be really hard to do with people who are on a lower caloric diet. So again, let's go back to that female runner. Let's say she's 60 kilograms, she's eating 2,000 calories. That would be 96% of her total caloric consumption. So that means she'd have to really increase her caloric intake, or we might need to shift that carb loading. Maybe she can't get that full carb loading. So we really have to adjust it and think about her body weight, but also think about how many grams you need to actually get the benefit of the carb loading. So what are some of the potential macronutrient wrecks for female athletes in relation to their ovarian hormones? So let's talk about the habitual diet. So just day-to-day diet, the nutritional strategy in terms of protein. If you're thinking about eumenoric and endurance athletes, the protein intake in general is equal to or greater than 1.6 grams per kilogram per day. But this has really only been assessed in the follicular phase. A higher intake may be required in the luteal phase due to that increased protein catabolism at rest during exercise. What about days before exercise? So here, in terms of modified carb loading, eumenoric athletes in the follicular phase who are endurance athletes, the recommendation is to increase energy intake by up to 30% to achieve carb intake that is greater than 8 grams per kg per day if you're going to be doing this on the high carb loading days. And you really have to do that amount to overcome lower muscle glycogen storage in the follicular phase. When we're talking about hours before exercise and that pre-exercising window, studying eumenoric, luteal phase endurance athletes, or studying those triphasic oral contraceptive users in the active and the inactive phases, a high carb meal or snack about 3 to 4 hours before exercise can be helpful. It can reduce demand on endogenous glucose production, which can be suppressed in the luteal phase and when someone is on the oral contraceptive pill. During exercise, so exogenous sources of carbs, what should we be recommending in terms of a snack while exercising? Here we're talking about eumenoric women who are endurance athletes. The carb intake should be about 60 grams per hour during prolonged exercise. So if you're going to be exercising up to an hour or more, you need 60 grams. When you're hitting over that 1 hour mark, you should be getting about 60 grams per hour. To reduce demand, this is really to reduce demand on endogenous glucose production. And there's limited potential immune disturbance in protein catabolism. Recovery after exercise, we want to make sure that we're getting carbs or protein in carbs. This has been studied in eumenoric follicular phase endurance athletes. It's been studied in eumenoric luteal phase endurance athletes. And so in both of these situations, an ingestion of carbs as soon as practical, following prolonged glycogen depleting exercise, co-ingested with protein can be helpful. This is to overcome potential reduced muscle glycogen resynthesis in the follicular phase and to offset the increase in protein catabolism and protect that muscle breakdown in the luteal phase. How about general nutrition and hydration considerations? So again, just the practical applications. Lower resting muscle glycogen in the follicular phase can be overcome by carb loading, but an increase in total energy intake may be required because it's really hard to do if you're not eating enough. Pre-exercise feeding and or carb ingestion negate the estrogen-induced reduction in gluconeogenesis during exercise. So exercise that's greater than 50% of VO2 max. Female athletes need to pay attention to recovery nutrition in the luteal phase, even more so, to offset the increase in protein catabolism. Estrogen and progesterone affect the hormonal and neural control of thirst, sodium regulation, and fluid retention, increasing the risk of hyponatremia during the luteal phase, particularly of the menstrual cycle. Hormonal therapy in menopausal women lowers the threshold for osmotic AVP release. So increased basal plasma volume expansion and decreased urine output. This results in greater fluid retention. We also know that estrogen enhances antioxidant capacity in females. Supplementing with dietary sources of antioxidants may be prudent in those with amenorrhea, those who don't have as much estrogen, and those who are in menopause, but it may still not compensate for that lack of estrogen. Fish oil or those omega-3 fatty acid supplements may aid in inflammatory disorders such as dysmenorrhea and those associated with menopause, because those are inflammatory conditions. We know that vitamin D and calcium actually play a role in fertility, possibly in dysmenorrhea, in addition to what most of us know about bone health, but they can't fully compensate for the lack of estrogen. So we still need that estrogen for bone. And branched chain amino acid oxidation may be greater with estrogen. Branched chain amino acid oxidation may be greater when estrogen is low. This may have dietary implications for those who are amenorrheic, again, or those who are in menopause. So especially those who are training regularly. Oops, I meant to do these all with arrows. What about potential female athlete and energy and nutritional issues? So a lot of things that happen with female athletes, things that we need to be aware of and have in the back of our mind are inadequate energy to meet energy demands. So thinking about the female athlete triad and thinking about relative energy deficiency in sport, considering the inadequate macronutrient intake, carb, protein, essential fats to meet the demands of various training phases for optimal performance, maintenance of lean mass and bone, and support for the immune system and brain health. We have to consider potential inappropriate timing of food intake and types of food around exercise and competition that can hamper performance and recovery. Also consider dieting for weight loss to achieve and maintain a competitive body size and composition. So when we have athletes who are in weight classes or they're trying to get down to a certain weight where they think they're going to perform ideally, sometimes they might transiently need to get to a lower weight. So we have to take that into consideration as well while maintaining a high level of fitness and performance. We have to consider elimination of food groups that can reduce energy intake and the important nutrients derived from these foods. And also inadequate micronutrient intake to support bone health. So calcium, vitamin D, basically folate, B12, energy production, the B vitamins, and maintain overall health. So basically, we also need to remember that this is a very important area of study. We really need to increase spending on female sports science and nutrition research. we potentially could really use our physiology to our advantage. There's just so much that we don't know. Keep in mind that yes, male sport organizations have more money. They do have more money, but women control so much of the spending. So $20 trillion, 85% of consumer spending is thought to be controlled by women. Women comprise 47% of the US civilian workforce. Women control 51% of the personal wealth in the US, an estimated $29 trillion. So we really should do the studies on these women, and we should have women advocating for that. We have to keep in mind that 50% of our population is women, and so many of our girls and women are doing sport. As we move forward, we also have to determine what we know and where the gaps in the research are. So this diagram kind of approaches how I want to be thinking about studying women and how the people that I work with are moving forward to kind of move the needle for women. When we talk about a topic in sports nutrition, we first want to do the data mining review. What do we know? What do we know about caffeine in women? What do we know about protein in women? What do we know about women during the menstrual cycle? Then we need to do the observational, correlation, and prevalence studies. What can we learn from the current practice? And what should we be studying just cross-sectionally? What are we determining? And then the interventional studies. So when we make these modifications in diet, are we doing these studies in a way that we are monitoring the menstrual cycle? Are we all on the same page and monitoring it using the same sort of techniques? Once we have the discoveries, then we really have to get those out to the world. We need to advocate about studying these things. We have to advocate about using these kind of things that we've discovered and applying them to day-to-day practice. We have to educate and train people so that they understand how they can use these different approaches that we've discovered and optimize training and nutrition and the menstrual cycle. So that is the end of my talk, and I'm happy to take questions. Thank you.
Hello. So we have some questions from the audience. The first question is, what do you think the most important aspects are for a male coach to take into consideration when coaching a team of female endurance athletes, as well as building relationships with those athletes? So that is a terrific question. I think there's a few things. Number one, we want our male coaches to be really comfortable talking about issues such as menstrual cycles and acknowledging that the menstrual cycle is really a vital sign. And so if a woman is not on birth control pills, she should be getting her period every month, or she should have a good reason for why she isn't. Now, having an athlete come and talk to the coach about that is not always a comfortable thing. So we want the coaches just to know that they can talk to the athletes as a group and say, it's important that you get your periods. It's important that you are comfortable talking to somebody about that. And this is where you can have this team, this entourage to help. So if you're at a school and you have an athletic trainer or you have a team physician, and then things like sports psychology, sports nutrition, I think just being very open and being amenable to working with a team of professionals to help the athletes and let those athletes know that those resources are there. Those are the most successful situations that I've seen. The next question is, how are you tracking the energy spent during exercise or physical activity? What is the most accurate way to track? Activity trackers, smartwatches are notorious for being inaccurate. Yes, this is the million-dollar question. So we know that the most accurate way to do this is doubly labeled water. That's a hard thing to do. This has to do with swallowing an isotope and having somebody be active. It really comes down to, if you're studying this, make sure that when you're doing that, see what resources you have and then do the best you can. And if you're writing a paper, extrapolating information from a paper, that you really understand how that was measured. So for example, was indirect calorimetry done? Was there a metabolic cart that was used? Were things basically calibrated according to a more accurate way to measure and then extrapolated so that somebody might use a heart rate monitor if they know how much different the heart rate monitor is from that gold standard, such as doubly labeled water. But honestly, these projects and these studies can be very expensive to do. So sometimes we just want to study a huge group of people and we want to extrapolate the information. So we might have everybody wear a heart rate monitor, fill out food frequency questionnaires, food logs, and then make some estimations. But when reading literature, we want to just see how that was measured so we can understand how accurate it is or not. And then another one, let's see, to what extent do you think females should change their diets following puberty and similarly post-menopause to keep up with the hormonal changes? That's a great one too. There's a lot more than we need to know. So first of all, the thing that I'm most focused on around puberty is making sure that puberty happens. We do know that energy availability needs are probably higher at that time. And so when somebody is growing and they're going through puberty, they probably need more calories. They need a higher level of energy availability. And I often see that our athletes are actually restricting more at that time. Their body is changing and they're getting more involved in sports. So it's kind of this miserable time that all the things are coming together. Their hormones are flowing. They're really focused on their sports. They're having body image issues. And so my biggest message is not to let people restrict. We want them to go through their puberty. We want them to grow. We want them to be putting on muscle mass. They need some essential fat on their body in order for all of their hormones to work and to recover from workouts and to have really good performance. So in that sense, I think people probably need to eat more than they realize at that phase. And then in terms of postmenopause, there are a lot of questions about, are there ways that we can adjust our diet to have more protein to help keep muscle mass? Are there different ways that we should be training in that postmenopausal period? More work needs to be done, but in general, we're starting to see that, yes, there probably needs to be a little bit of shift in terms of the macronutrients during that later phase in life. Another question is, with higher and lower menstrual loss, how should iron be adjusted and what guidelines would you recommend? So basically measuring the iron, measuring ferritin, total iron binding capacity, and then really using those lab results to base the decisions about how much supplementation. I've had a lot of athletes come to me and say, oh, my coach told me to take liquid iron. And really they had no idea what their iron level was to begin with. So at a minimum, we want most of our athletes to have a ferritin level of 30. Some people can live lower, but really if you want good oxygen carrying capacity, we think 30 is probably as low as we want to go. And then if you've got somebody who's an endurance athlete and they're a woman, keep in mind they're losing blood through their period. They're losing blood if they're running from foot strike hemolysis, and they're having increased red cell breakdown just from being an endurance athlete in and of itself. So if you have all three of those things, that person is going to be at higher risk for iron deficiency. So they should be monitored every few months with their ferritin levels checked. Also keep in mind that ferritin can be an acute phase reactant, so it could be elevated in states of inflammation. So you really want to get the full picture, the hemoglobin level, ferritin, total iron binding capacity, and total iron. What would the impact of hormonal IUDs implants be on performance or nutritional needs? Are there systemic metabolic implications even with localized hormone release? So that is an area of study that really needs to happen. We think that hormonal IUDs are mostly acting locally, so they don't have as much of an effect as an OCP would, but there really needs to be more done there to give more information about how to advise in terms of nutrition. Another question is, most of these studies are on female endurance athletes in land-based sports. What about swimming? Great. So the information about endurance athletes still applies. So that study that I mentioned in the talk about swimming in terms of somebody who's amenorrheic and having suppressed hormone levels and following them over 12 weeks, and we saw that they got slower. So that was a study that was done in swimmers. Certainly when we're talking about iron studies, again, they're not having the foot strike hemolysis, but some of the nutrition, just general metabolic nutritional findings apply, whether it's somebody who's on land or on water, as long as it's talking about the level of exercise that the person's doing and the type of endurance work that they're doing. For carb loading, with higher increase in muscle glycogen concentration percentage, are men seeing improvements in time trials where women are not? Yes, so that was one of the things in one of the slides. Let me go back a little bit. When we talked about carb loading for female endurance athletes, it can be really hard for a smaller endurance female to get enough carb loading because they have to have such a huge percentage of their diet be carbohydrates. It could be, up to 96% of their caloric intake, which is absolutely huge. So usually for women, not only do they need to increase carbs, but in order to accomplish that, they need to increase their overall caloric intake. Whereas men really demonstrate an increase in muscle glycogen concentration with carb loading a bit easier than women do. And then our last question, how do you determine calorie energy requirements for young athletes just entering puberty to make sure that they are not going to head towards RED-S or REDS? Love that one too. So I work very closely with our sports dietitians. In general, the average age of menarche is age 12 in the United States. We consider it delayed menarche if it's after 15 and a half. Basically, we want to follow our athletes' growth chart. So are they growing in terms of height? Are they growing in terms of weight? And is that staying around the same? And they're staying on their own personal curve. And so as they're entering puberty, we want to see them on their curve. If they're dropping off in weight or if they're slowing down in their height before they should, that's letting me know that they're energy deficient. So if we're trying to keep it from happening, it's really making sure that they're traveling along their growth curve. If they are already in a state of some slight menstrual irregularity or their body composition is really changing and we think, uh-oh, they're headed south, in that sense, we can really work with the athlete, work with the dietitian to help give them little strategies where they can be having more snacks or they can be thinking about ways to get food into their busy day. We particularly see this with some of our performance athletes, so dancers who are in the studio a long time and aren't supposed to be eating in the studio. We have to get very creative about how to keep them from falling off their growth curve and falling into situations of REDS. So we figure out ways to give them quick snacks and quick options that they can carry with them. So thank you for your time and enjoy the rest of the day.